Welcome, everyone. Today, we're taking a deep dive, not into the Mariana Trench, but maybe something just as pressurized, the history of hyperbaric oxygen therapy.
That's right. And look, we know you, our listeners, are experts. You live and breathe this stuff, probably even calculate partial pressures in your sleep.
Yeah, probably true. So yeah, we're not covering Henry's Law 101 today.
No, definitely not. The idea is to excavate, you could say, the foundations. We're looking at those key early studies, the ones that really paved the way for everything we do now.
Exactly. Our mission, if you will, is to explore how this field evolved, focusing on the actual evidence that popped up along the way.
Let's do it. Where should we start? Way back.
Yeah, let's go way back. Before we even thought about flooding chambers with oxygen, people were just thinking about pressure.
Mhm.
Like 1562, there was this guy, Henshaw.
Oh, right. Henshaw and his domicilium. Fancy name.
It was basically an airtight room. The idea was, crank up or lower the pressure to help with things like digestion, breathing issues.
Sort of a 17th century wellness pod. But did it actually get used? I mean, is there any record of patients lining up?
Funny you should ask. Doesn't seem like it. It's more like this interesting concept that was floated.
A historical footnote, almost. And what's really wild is that after Henshaw, things went quiet for, what, nearly 200 years?
Yeah, like the idea just kind of deflated. You'd think someone would have picked it up sooner.
Maybe the tech just wasn't there. Hard to build a reliable pressure chamber back then, I imagine.
Good point. So, okay, let's fast forward. When does oxygen actually enter the picture in a formal study kind of way?
You're probably thinking of the 1930s. There was a really key paper in 1935. Benke, Fenmore, Poppin, and Motley.
Right, the title was pretty straightforward, wasn't it? Something like,
The effect of oxygen on man at pressures from 1 to 4 atmospheres doesn't get much clearer than that.
no messing around there.
It was really one of the first proper looks at what happens physiologically when you breathe pure oxygen under pressure. Foundational stuff.
Absolutely crucial. But I guess playing with high-pressure oxygen wasn't all smooth sailing. People must have realized pretty quickly there were risks involved.
Oh, for sure. The whole oxygen toxicity issue. It's that double-edged sword, right? We
Ah.
need it, but too much, especially under pressure.
Hmm.
Well, that's bad news.
The free radical theory comes into play here, doesn't it?
Exactly. The idea that your body produces these overly reactive byproducts of oxygen metabolism, free radicals.
Right, those little molecules with the unpaired electron just itching to react with whatever's nearby.
Precisely. And they can damage important things, enzymes, deoxyribonucleic acids, cell membranes. It's like microscopic vandalism.
Not good for cell health. Who are the key players in sort of mapping out this toxicity?
Well, Clark did a big review in 74. The toxicity of oxygen really pulled together what was known then.
Okay.
And then later, the 88 Handbook of Hyperbaric Oxygen Therapy had important sections on it, too. People like Fisher, Jane, Braun, Laurel contributing.
Right, codifying the knowledge.
Yeah, and, research continued. There was even a study in 93 by Lynn and Jameson looking at how humidity affects oxygen toxicity.
Humidity, really, that seems counterintuitive.
Doesn't it? Who'd have thought a bit of damp air could change how your lungs react to hyperoxia? Shows how complex it is.
Absolutely. Okay, so they're figuring out the basics, the risks. When do we start seeing it applied to specific conditions? Decompression sickness seems like the obvious first candidate.
It really does. The physics line up so well. Pressure, gas bubbles. It just makes sense.
So what's the early evidence there?
Well, interestingly, there's a study from 1954 by Cross. It wasn't directly on decompression sickness, but it looked at using pressure and even oxygen-helium mixes for bowel obstructions involving gas.
Bowel obstructions, how does that connect?
It's about managing gas bubbles in a biological system under pressure. So the principles, understanding how pressure affects gas absorption and tissue viability, those insights were relevant.
Okay. So tackling gas bubbles in the gut gave clues for tackling them in the bloodstream.
Clever. Kind of. Then later, you get more specific work. James, in 81, wrote about the tricky parts of treating neurological decompression sickness.
Yeah, the neural stuff is always complex.
And of course, you have things like the U.S. Navy Diving Manual, the 74 edition, would have laid out treatment protocols. Then Catron and others in 87 looked specifically at using helium oxygen for experimental decompression sickness after air dives, always tweaking the approach.
Constantly refining. Okay, what about carbon monoxide poisoning? That's a big one for hyperbaric oxygen now. Was it always?
Not quite as clear-cut, actually. Even into the mid-90s, there was still quite a bit of, let's say, discussion. especially about using it for the milder cases.
Really, a bit of debate in the field.
Oh, yeah. Some early American data around 96 suggested it helped, but there wasn't total agreement.
What was the sticking point?
A lot of it centered on carboxyhemoglobin levels. Should you treat based purely on the number or more on how the patient looked clinically? Different hyperbaric docs had different opinions back then.
Interesting. So the evidence was still building.
Definitely. You had work like Hopkins and Weaver in 91 looking at using repeated treatments later on for those delayed neurological problems you can get.
Right, the delayed sequelae.
And the really tough question of treating pregnant patients came up too. Van Hosen and colleagues asked the question in 89, and El Carret et al. Published on it in 91. Huge responsibility there, considering both mother and baby.
Absolutely critical. Now, here's one that might surprise some listeners. Obstetrics. Using hyperbaric oxygen in pregnancy itself.
Yes. It's perhaps less well known now in many places, but there was a fair bit of research, particularly coming out of Russia in the early 80s.
What specifically?
Studies on things like toxemia of pregnancy, placental insufficiency, Proshina and others published on that in 83. Stepanian's group looked at late toxicosis around the same time.
Wow.
And Vanina's team explored using hyperbaric conditions more generally during childbirth and care. It was definitely an area of active investigation there.
Fascinating how research can concentrate geographically like that. Okay, let's shift to an area where hyperbaric oxygen really found its footing. Surgery and wound healing.
Right, a major application today. The early seeds were sown quite a while back. We could even loop back to that cross study from 54, again, bowel surgery, gas dynamics relevant to post-op healing.
Okay, connecting the dots.
What else? Fast forward a bit, Zamboni and colleagues in 93 did some really elegant work looking at microcirculation, like breakdown at the capillary level during reperfusion after ischemia, and how hyperbaric oxygen affected that.
Seeing the effect on the tiniest blood vessels, that must have been persuasive.
It really helped visualize the mechanism. Then around 1990, you see studies like Wattel's group on chronic vascular wounds and Yamaguchi looking at burn and inhalation injuries.
And underlying all this is the basic biology, right? The need for oxygen and healing.
Absolutely. People were connecting the dots biochemically, too. Way back in 67, Hutton, Tappel, and Udenfriend showed how crucial oxygen is for collagen production, specifically for the enzyme collagen proline hydroxylase.
Ah, the building blocks of repair.
Exactly. And then Johnson, Hunt, and Mathis in 89 specifically showed oxygen was a key factor in fighting infection. Johnson's team in 91 tied together tissue oxygen levels, anemia, and perfusion for wound healing.
It's like putting together a puzzle.
It is.
Yeah.
And Kifasari and Ninakoski in 75 directly compared hyperbaric oxygen versus hypoxia for open wounds. So lots of different angles all pointing towards oxygen being critical for repair.
A really solid base of evidence building up over decades. Did they even try it for things like brain abscesses early on?
Seems like it.
Yeah.
There's a 1969 study by Gott and Hallback mentioning hyperbaric oxygen for neurosurgical patients, which could include things like abscesses, maybe more exploratory at that stage, but shows they were thinking broadly.
Bold. Okay, none of this work, especially the physiological stuff, happens without measurement tools, right?
Yeah.
How did they actually track oxygen levels?
Crucial point. The technology had to evolve alongside the therapy. The very basic principle, polarography for measuring oxygen, goes back ages. Salomon in 1897, Harovsky in 1925.
Wow, really early. But for biological use, the big step was probably Davies and Brink in 1942. They developed these tiny platinum microelectrodes you could actually use in vivo.
In living tissue. That's a game changer.
Huge. Then Clark, in 56, made it even more practical with a membrane-covered sensor. That basic Clark electrode design is still relevant today.
Amazing lineage. What about less invasive ways to monitor?
Right. Fast forward again to the 80s and 90s. Transcutaneous oxygen monitoring, TCPO2, became important, measuring oxygen through the skin.
Less direct, but non-invasive.
Exactly. It gives you an idea of tissue perfusion. Matthews' group did key work using it for post-traumatic limb ischemia in 90 and skin flaps in 93. Hauser and Shoemaker had developed a regional perfusion index using it back in 83.
So tools to assess if the hyperbaric treatment was actually improving oxygen delivery out in the tissues.
Precisely. Very useful clinically.
Okay, last piece. The chambers themselves. They obviously got more sophisticated than Henshaw's room.
Just a bit. Yeah, the engineering kept pace. By the late 80s, early 90s, you see references to specific ventilators designed for hyperbaric use, like the Penlon Oxford.
Ventilators inside the chamber.
Yeah, Boucher and others evaluated one in 89, and Weaver's team in 90 was doing neuromonitoring under hyperbaric conditions. Rocco discussed hemodynamic monitoring inside the chamber in 95. It all points to increasingly complex patient care happening during the dive.
Wow. From a simple pressure box to essentially an intensive care unit under pressure. Quite the journey.
It really is. You look back at those early concepts, the first physiological studies figuring out toxicity, the initial trials in decompression sickness, carbon monoxide, wounds. All of that groundwork was absolutely essential for where we are today.
It's quite humbling, actually, thinking about the insights they gained with, comparatively simpler tools back then. They really built a strong foundation.
Absolutely. So maybe a final thought for you, listening in with all your expertise. Reflecting on this history, these foundational studies, what strikes you as maybe the most unexpected turn the field took? Or what were the really persistent challenges in getting hyperbaric oxygen established as solid evidence-based medicine?
Yeah, how did these early findings really shape the way you practice, the questions you ask in your own research today? Something to ponder after this deep dive into the past.